Minoxidil, one of the most commonly prescribed hair loss drugs and one of only 2 FDA-approved drugs for treating pattern hair loss. Is this something you're aware of? Are you someone who's losing their hair and you've researched the heck out of the internet and you want to know more about this particular hair loss medication? Well, in today's video, myself, Dr. Jonathan Hopkirk, a hair loss doctor based in Sydney, will break down just how effective minoxidil is. We will talk about the topical form of minoxidil, which is what is FDA approved for, topical application to the scalp, and we'll also talk about the off-label use of minoxidil when taken orally for treating pattern hair loss and other forms of hair loss. So if this is something that you would like to learn more on, tune in and I will give you some key insights on just how effective this hair loss medication is. Now, as a disclaimer, this is not a substitute for medical advice, and I would always advise you to seek the counsel of your local doctors to be able to give you better guidance on how to make decisions that will benefit your hair, but also taking into consideration your health. So before we jump into it, let's give a quick brief rundown of what minoxidil is and how it works for hair loss. So if you haven't caught some of my videos previously on minoxidil, minoxidil was originally used as a blood pressure medication at much higher doses. And in the 80s, it was found that people taking this blood pressure medication started to restore their hair and have hair growth in other places around the body. So it was then approved by the FDA in the 1980s to be used as a topical drug for male and female pattern hair loss. It is also used off-label when taken orally in lower doses to also treat male and female pattern hair loss. Now, how does it work? Well, they're not still entirely sure on the exact mechanism of action, although there is lots proposed. But with respect to hair, it is a drug which causes vasodilation, which improves nutrient delivery, oxygenation, and blood flow delivery to the hair follicles of the scalp. Now, it is a drug that is actually in its prodrug form, which means it needs to be sulfated or converted into its active drug form, minoxidil sulfate, through a process where an enzyme called sulfotransferase converts it into this active form. Now, what's interesting is that only a certain percentage of the population actually have high numbers of this particular enzyme, which then means not everyone gets the benefits of this drug for their hair. From a hair loss perspective, it is said to work on various different signaling pathways, one of which is the beta-catenin signaling pathway, and it is also said to potentially lead to the release of certain growth factors in the scalp. Now, it can be taken orally at low doses such as 2.5 or 5 milligrams, usually taken once a day, or it is often used topically, with people applying a 5% or a 2% and sometimes higher concentrations to the scalp once or twice a day. Okay, so now that we've got a good understanding around just what minoxidil is, now let's talk about how effective it is as a hair loss drug for androgenic alopecia. And I'll be focusing today on male androgenic alopecia. So let's focus first on the topical form of minoxidil used for androgenic alopecia. Well, this particular study by Olsen et al., published in 2022, is one of the foundational studies that gives us a really good understanding around just how effective topical minoxidil is. So this was a 48-week study in a group of 351 men who were split into 3 different groups. One group used 5% topical minoxidil applied twice a day to the scalp. The second group used a 2% concentration of minoxidil applied twice a day to the scalp. And then a third group, which was a placebo group, applied a placebo non-minoxidil inert serum to the scalp twice a day. And then they followed up and reviewed the hair metrics and various other assessments at the end of the 48-week period. What did they find? Well, in the 5% topical minoxidil group, the average increase in non-vellus hairs, so non-baby hairs, so thick hairs, was 18.6 in the 5% group versus only 12.7 in the 2% group versus only 1.5 in the placebo group. So quite a good gain over that 48-week period. Now, they also had independent viewers review photos of these patients from the various groups. Now, what they reported is that between 54 to 62% of those in the 5% topical minoxidil group achieved hair regrowth versus only 30 to 38% of those in the 2% group. What they also reported is that those in the 5% topical minoxidil group achieve results much sooner than those in the 2% topical minoxidil group, which is really interesting to note. So there we go. It was deemed by those objective metrics, as well as photographic assessment, as well as patient reports, that the 5% topical minoxidil was quite effective, achieving results in, on average, about 60% of people who are using it. So then what about oral minoxidil? So oral minoxidil is used off-label for treating hair loss conditions like male or female pattern hair loss, but exactly how effective is oral minoxidil? While it can be used, as we just discussed earlier, the doses of 2.5 milligrams or 5 milligrams, sometimes lower doses in certain individuals, there's actually a scarcity of long-term randomized controlled trials on the use of oral minoxidil. But one of the more recent studies, published in 2019 by Jimenez et al., was a retrospective study of 41 men with male pattern hair loss who were taking either 2.5 milligrams or 5 milligrams of oral minoxidil daily. Now, what they reported is that there was a marked improvement, either an increase in 1 point on the Hamilton-Norwood scale or more, in 26.8% of the patients. There was a general clinical improvement noted in 90.2% of the patients, and it was noted that there was a stabilization of the loss in 9.8% of the patients. So even though this is in a randomized controlled trial, which is the gold standard, and the group is less than what we would like, which would be about 100 patients, it does still show that the majority of people taking oral minoxidil at low doses for androgenic alopecia will achieve some results. Now we know whether it's topical or it's oral, the results you achieve are influenced by a number of different factors, as hair loss is multifactorial, and you as an individual have a multifaceted makeup. There's lots of things going on in both your system, but also to your system on an ongoing basis, which can have an impact on just how well you respond to a certain medication, whether that be topical or oral. So I hope you gained something out of today's discussion on minoxidil and just how effective it is in either the topical or the oral formulations. Tune in to a future video, which I'm going to do to assess the one study that has been published on these two head-to-head, so oral minoxidil versus topical minoxidil in a 6-month-long randomized controlled trial. So we will dig into that next, but I hope you have a good week. Thank you for tuning in. If you like the video, please like and subscribe and share. If you have any commentary on minoxidil, whether you've used it yourself or you have comments on papers that you think I might be interested in, please plug them in the comment section below. Thanks again for watching. See you again next week. Cheers.